Hey guys, my name's Sam. Welcome to Prep Medic. This week's video is an IFAK review. Today we are taking a look at the RTS Tactical Rapid Deploy IFAK. So RTS Tactical is a tactical distributor based out of Miami, Florida. Now they do sell other brands, but they also have their own stuff that they design and manufacture, and this is one of those items. So like I just said, this is the Rapid Deploy IFAK, and it is a very unique form factor, one that we don't see on a lot of other IFAKs. Predominantly this is meant to be mounted on a belt, but you could absolutely put this on a plate carrier or even an off-body carry solution like a backpack, anything like that. Right now, it's coming in at about $170 fully stocked. But as you guys know, in this economy in particular, that could change at any time, and that price is definitely going to go up over the years, or at least I think it will. Now, this comes in 3 different colors. We've got Ranger Green here, which is one of my favorite colorways. It also comes in black and Coyote Brown. With all of that being said, let's get into the video. So on the outside, this is a pull-through design, so you actually pull the IFAK out of the side, which means that what's covering the actual case that holds the medical supplies is a full elastic band. There's no like hardcore Cordura nylon on this. Now this is a very thick elastic band. I'm not entirely sure what it's all made out of there, but this entire thing right here is elastic, and that gives you the retention of the IFAK itself. On the back, you have laser cut holes that this can be weaved through MOLLE, and if you have some discrepancies on your MOLLE webbing, these are spaced pretty close together. It will be easy to attach on pretty much anything. And then of course you have a belt pass through here if you'd rather just mount it to a duty belt that way instead of trying to MOLLE it to something, which is nice versatility to have. You'll notice the way this is oriented and the way the pictures are online, it looks like it's meant to be mounted like this with the cat tourniquet on top, which is a little bit unusual. Usually we have these dangling down, and you definitely could mount this on a belt just like this too. It would work either way, but it looks like it was intended to be this way, which is interesting, but not altogether bad. As you see, this has a cat tourniquet. They come with all of the kits. Obviously, I'd take this out of the wrapping before I'd use it, and that is secured with another elastic band right here. So to deploy the IFAK, you pull it out from the side. If it's mounted to something, it's a little bit easier. And here you can see what I was talking about earlier. This is just an elastic loop that will keep this retained inside. One of the nice things here is once you pull it out, this can be like lay flat. It's not going to be getting in the way, anything like that. I will say if you are mounting this in the back of the belt, which I think is how I mount this kind of IFAK the most, just because I pull it from either side and bring it to my working space. If it was in the front, I'd have one that folds down just so I could work out of it and not necessarily deploy it. But if you put this in the back, it's going to be fine for running around. It'll work just fine. For me, this would be just a little bit bulky if I'm doing any kind of vehicle operations at all. If I'm going to be sitting for a long period of time, this might not be my first choice just because it is pretty thick. Now, they make a mini version of this, which I will review on another video. So this one right here is thinner. It still has a little bit of bulkiness, but it will give you a smaller form factor if that's what you're thinking. Now, right here, I have the case. Now, this is pretty heavy duty Cordura nylon. These 2 pull straps right here have this support in them, and they're like triple stitch. They feel really, really sturdy. I don't think that's going to come apart anytime soon. You have these 2 zippers with pretty large pulls on either side, but of course it is designed to be deployed right here just by pulling down, opening the entire IFAK. At the top here, you have this red swath. If you want to be totally covert or you want to have it say something else, you can pull this guy off right here and throw something else on if you want to say something, or if you just don't want red on your IFAK. That is an option. It does have a Velcro closure, so if I open this up and I don't want to zip up both zippers, I can just take it, fold it back on itself, and it's going to stick right there. I can kind of throw that in a pocket or throw that back in the pouch. I'm not super worried about the contents coming out. Like I said, this comes totally stocked. So what you see in here is what you're going to get if you order this IFAK in particular. I do want to come out and say this was sent to me free of charge, but like I've said in other videos, I have so many IFAKs. I don't care. That's not going to stop me from giving an honest review of this. And they aren't telling me I have to say anything nice about it. So these are my honest opinions. So right here, we've got a pretty customizable interior. So you have this shock cord that kind of weaves through the entire thing. And this is all one piece of shock cord. This is one big piece of shock cord that comes through the entire top of this, and it is tied. Now, it's pretty easy. Hang on, I got one right here. To undo the knots and throw in one of these clips. I don't even know what these clips are called. I wish these IFAK manufacturers would just throw these in here. They're super cheap, super easy to do, and it just makes it a lot easier to adjust everything on the inside. So if I was using this regularly, I'd throw one of these clips on just to adjust that shock cord for exactly how I need it. Now, one thing I really like is when you look at this, it's not jam-packed. This is not like perfectly folded. Like I love the Blue Force Gear micro IFAK or whatever they call it. Like that's a good IFAK. The problem with it is that like, unless you really know what you're doing, it is really hard to pack your own stuff in there. In here, it's pretty easy to do. And I'll be honest, this actually is very reminiscent of one of VanQuest Gear's packs or the Roaring Fire Gear packs I reviewed a little while ago. Like the layout is very similar, it's just a little bit different proportions. So all of that being said, let's go through the contents. What do you get when you order this? So right here, we've got an emergency bandage. This is just a pressure bandage that will allow you to throw it on an arm, and it's got a little stick on it to help provide a little bit more pressure. So this is good for keeping wound pack in. It's also really good for wrapping, head wounds or extremity wounds that don't need a tourniquet, but still need bleeding stopped pretty quickly. So that's right up here in this. Now we have some lubricant in there, and it's kind of weird placement where they had it when I got this. I don't really know why it was up here. I would have put it or like taped it next to the NPA, which we'll talk about here in a second. But that lubricant is for the NPA. We got medical tape, which is great to have right here. It's not the most convenient form factor, but it fits, and it's looped in with the elastic. Right there, you've got compressed gauze for some wound packing. There's a little bit more in here we'll talk about right there. So then we have an NPA 28 French, great for military-age male patients. But if you are in the US and you're running this with like a family member on the range, or if you have, smaller female officers or smaller male officers on your force, and this is a law enforcement kit or something like that, you should consider diversifying the size of your NPA. That being said, 28 French is standard in IFAKs. It's what you're going to get because it's going to fit a pretty wide population. You have a glow stick or a chem light if you want to be really tactical here. These are really good for marking casualty collection points. It's one thing you can flag outside a door that you're in, or this is where you're taking people. You can flag the entrance you want EMS to take when they arrive. It's just good to have some marking. Now you can also flag with tape. Just do whatever. If other people understand what you're doing, just do that. It'll work fine. All right, so coming into it a little bit farther here, we have some nitrile exam gloves. These look like sterile gloves, to tell you the truth. You don't need sterile gloves in the pre-hospital environment. It's not something like, even when we're doing like chest tubes on the helicopter or something like that, sterile procedures in the hospital, nothing is sterile pre-hospital. We go for relatively clean. There's a whole process for putting sterile gloves on. Yep, these are sterile gloves in the extra large size. I don't know why this is in here. Is sterile gloves, is it gonna hurt anything? No, it's not gonna hurt anything. But like, to put these on appropriately, like actually takes some training and some time to do, and ain't nobody got time for that when somebody's shot in front of them. And this kit isn't really set up to do like finger Thors or anything that you would traditionally need sterile gloves for, but hey, you got sterile gloves. And no, somebody on here is like, well, normal gloves are sterile. They're absolutely not sterile. They're not sterile at all. Gloves in the pre-hospital environment are purely meant to protect you, the wearer. They are not meant to protect the patient. Okay, so tangent aside, let's continue going into it. We've got quick clot bleeding pads. Now, I'll open this up and show you guys. This is not enough to pack most wounds. It'll be enough to pack some wounds. This is the standard QuikClot gauze. So it's a hemostatic agent that just helps promote fibrin clot formation. Studies have shown that normal packing gauze is almost as effective as this. This stops bleeding slightly faster, but no difference in mortality. So what you can do with this, if this isn't quite enough, you can start packing this into the wound and then start packing this gauze over top of it to give you the volume and the pressure you need to start to stop that bleeding entirely. After all, the most important thing is the pressure. That's what matters. This just helps a little bit. So start with this and then you can move to it. I'd like this to be the full, LE QuikClot. That being said, that's going to raise the cost substantially. This guy right here, like you can buy these for like maybe $1, maybe $2, and that LE or military QuikClot is going to cost you like $55 now. So this is already an expensive pack. It's $170, which like isn't astronomical when you look at a lot of other similar products. But if you threw in the QuikClot, it might raise it a little bit more. Right here, we've got Hyphen, vented chest seals. I like these. These are my go-to, especially for if you're packing down into a tight space. These will help prevent the buildup of a tension pneumothorax. There is some controversy on chest seals right now. If they're doing what we think they're doing, there are some protocols that are going to just leaving open chest wounds open. As far as sealing an abdomen with chest seals, fine. If you want to do it, that's fine. But like, there's literally no data out there to suggest that really, really helps your patients unless they're out there for a long period of time. Now, last but not least, I love this inclusion because we don't see this in a lot of IFAKs. It's like this overlooked thing. We're just going to assume that everybody's going to have a pulse and it's always going to be bleeding. But right here, we've got a CPR face shield. So this right here, don't make the mistake that I made when I first tried to use one of these in the real world. This thing right here does not go up. You don't put your mouth on that. That actually goes in the patient's mouth. It's like a bite block for their teeth. And then this goes over their face. You're going to breathe down into this. It's got some filters there to stop gross contaminants. Now, is this going to, stop you from contracting Ebola when you do it? Probably not. But it's going to keep the majority of the vomit off you and keep you from making like skin-to-skin contact. So BVM respirations, great, but we can't always carry a bag valve mask with us. Sometimes this is what we got, and I'm willing to do this. If I had to do respirations on a patient, I have done them on a patient in the past, I would do mouth to mouth with this barrier device. I wouldn't be too concerned about it. So that's just me. Obviously, you have to make your own decision. Now, I will tell you that this is great for the patient that's not breathing. If you're trained on 30 to 2, that's excellent. Do 30 to 2. But there's a fair amount of data that says compression-only CPR is A-okay for patients. So while CPR is not going to help you with that opiate overdose or something like that, where they need rescue breaths, they don't need compressions yet, continuous CPR for cardiac arrest will help them if you don't feel comfortable doing that. So that is another option for you. I just like having this. It's just another option. It weighs nothing. It takes almost no space up in this IFAK, and it's just kind of cool that they included it in here. All in all, I think this offers a lot of opportunity for customization. As you guys saw, this wasn't jam-packed. I could throw more in here, and actually it did have one more thing in this IFAK that I forgot to mention. Right here, we've got these trauma shears, RTS Tactical branded. These aren't the $2 cheapy shears. These aren't the $50 expensive Raptors or X shears. They're gonna work for 3 to 4 uses, and that's literally right in here. But like I was saying, you can add a lot more to this kit if you want to carry a little bit more or switch out components for your own role. So I will leave a link to this product down below. If you have any questions, leave them here and I will see you next week.